The 40 or so weeks of pregnancy are a magical time. Keeping a healthy lifestyle throughout pregnancy, as well as before and after, is key for both the baby and the mother. Important steps to a healthy pregnancy include eating a balanced diet, gaining the right amount of weight, enjoying regular physical activity, taking a vitamin and mineral supplement if recommended by your physician or dietitian, and trying to avoid alcohol, tobacco, and other harmful substances. Moms-to-be need to eat a variety of foods from all of the MyPlate food groups. A balanced eating plan with a variety of foods can provide healthy women with enough nutrients for a healthy pregnancy. A balanced eating plan for pregnancy should include whole grains like breads, cereals, pastas, and brown rice. Fruits of all types, including fresh, frozen, or canned without added sugars. Vegetables in a variety of colors, including fresh, frozen, or canned, and when using canned, simply rinse them off to get rid of 60% of the sugar that's used in the canning process. Raw sprouts should be avoided at this time. Lean protein. Choose lean protein from meat, poultry, fish, eggs, and peas, peanut butter, soy products, and nuts. Pregnant women should avoid eating shark, swordfish, tilefish, king mackerel, and limit white albacore tuna to 6 ounces per week. Deli, luncheon meats, and hot dogs should be reheated if consumed. Low-fat or fat-free dairy. This includes milk, cheese, and yogurt, unpasteurized milk, and some soft cheeses that are made from unpasteurized milk should also be avoided. Eat healthy fats from fruits and foods such as avocados, nuts, and seeds, as well as vegetable oils including canola and olive oil. Avoid extra calories from added sugars and solid fats, which can lead to unhealthy weight gain. Cut down on foods such as regular soft drinks, sweets, and fried snacks. Eating for two is not the same as eating twice as much food. Pregnant women need about 300 to 400 extra calories a day, and breastfeeding moms are recommended to eat approximately 500 calories over non-pregnancy needs. But where these calories come from matters. If you eat sweets or junk food, the extra calories do not provide the nutrients your baby needs. As a result, your growing baby will get the vitamins and minerals it needs from your own body, and your health could suffer. How much weight should you gain during pregnancy is based on your body mass index before pregnancy. BMI is a measure of body fat calculated from height and weight. Recent studies found that about 1/3 of women gained the recommended amount of weight during pregnancy, and most women gained outside the recommendations. 21% gained too little, 48% gained too much. For more information, visit Healthy Weight Gain During Pregnancy from the Institute of Medicine. If you're pregnant with triplets or more, talk to your doctor about your weight gain goals. What does diet during pregnancy mean? When we refer to diet during pregnancy, we are not speaking about restricting calories or trying to lose weight. Dieting to lose weight during pregnancy can be hazardous to you and your baby, especially since a weight loss regime may restrict important nutrients such as iron, folic acid, and other important vitamins and minerals. Healthy eating during pregnancy is critical to your baby's growth and development. In order to get the nutrients you need, you must eat from a variety of food groups, including fruits and vegetables, bread and grains, protein sources, and dairy products. Therefore, we recommend avoiding popular diets such as Atkins, South Beach, The Zone, raw food, keto, and so on. Although the main source of vitamins and minerals needed during pregnancy should come from your diet, a daily prenatal vitamin can help fill small gaps, just in case you unintentionally do not get enough key nutrients. Prenatal vitamins should be taken up to 3 months before conception if possible. Remember, a prenatal vitamin or any other supplement can only complement a healthy diet during pregnancy. Consult your healthcare provider about which supplement is best for you. If you're pregnant, you're at an increased risk of iron deficiency anemia, a condition in which you don't have enough healthy red blood cells to carry adequate oxygen to your body's tissues. Iron helps to carry oxygen to your growing baby and also carries oxygen to your muscles to help avoid symptoms such as fatigue, weakness, irritability, and depression. Dietary sources of iron include lean red meat, poultry, and fish. Other options include iron-fortified breakfast cereals, prune juice, dried beans, and peas. The USRDA recommends about 27 milligrams of iron a day. Prenatal vitamins typically contain iron. Taking a prenatal vitamin that contains iron can help prevent and treat iron deficiency anemia during pregnancy. In some cases, your healthcare provider might recommend a separate iron supplement. Consult your doctor about taking a 30 milligram iron supplement along with vitamin C to prevent iron deficiency anemia during pregnancy. GI discomforts such as bloating and constipation are very common when taking iron supplementation. If constipation becomes a problem, take a stool softener to help relieve the discomfort. It's important to consume adequate amounts of calcium during pregnancy to support the musculoskeletal, nervous, and circulatory systems. Your body will do whatever it needs to take care of your baby, including stealing calcium from these areas. Your body actually takes calcium from your own bones or teeth to give it to your little one. Pregnant women who do not consume sufficient amounts of calcium are at great risk of developing osteoporosis later in life. Since your body cannot make calcium, you need to get it from food or supplements. While you're pregnant, try to get at least 1,000 milligrams of calcium every day. If you're 18 or younger, you need at least 1,300 milligrams of calcium every day. Dairy foods such as milk, cheese, and yogurt are some of the best sources of calcium. Dark, leafy green vegetables also have calcium, but in smaller amounts. Some foods have calcium added to them, including calcium-fortified cereals, bread, orange juice, and soy drinks. Check food labels to know for sure. If you're unable to consume dairy products, ensure to consume adequate calcium-fortified fruit items. During early development, folic acid helps form the neural tube. Folic acid is very important because it can help prevent some major birth defects of the baby's brain and spine. Folic acid is a B vitamin our bodies use to make new cells. Think about the skin, hair, and nails. These and every other part of the body make new cells every day. Folic acid is the synthetic, that is not naturally occurring, form of folate that is used in supplements and in fortified foods such as rice, pasta, bread, and some breakfast cereals. All women of reproductive age should get 400 micrograms of folic acid each day to get enough folic acid to help prevent some birth defects. About half of U.S. pregnancies are unplanned, and major birth defects of the baby's spine or brain can occur very early in pregnancy, 3 to 4 weeks after conception. However, it's difficult to get 400 micrograms of folate through diet alone. You can get 400 micrograms of folic acid each day by taking a vitamin with folic acid in it, eating fortified foods, or a combination of the two, in addition to consuming a diet rich in natural food folate. Dehydration during pregnancy can lead to serious pregnancy complications, including neural tube defects, low amniotic fluid, inadequate breast milk production, and even premature labor. These risks, in turn, can lead to birth defects due to lack of water and nutritional support for your baby. Dehydration is the result of your body losing water faster than you are taking it in. When you're pregnant, you need more water than the average person, at least 8 to 12 8-ounce glasses per day. Some fruits and vegetables are more than 90% water. Cantaloupe, grapefruit, strawberries, watermelon, broccoli, cabbage, cauliflower, cucumbers, lettuce, peppers, spinach, tomatoes are all at least 90% water and a great source. Eat a balanced diet that includes fruits and vegetables. They contain a large amount of water, salt, and vitamins that can help with dehydration and prevent constipation. The 2015 to 2020 dietary guidelines for Americans recommend that women who are pregnant or breastfeeding consume between 8 to 12 ounces of a variety of seafood per week, primarily with choices that are lower in mercury. Fish are a part of a healthy eating pattern and provide protein, healthy omega-3 fats, vitamin B12 and vitamin D, iron, which is important for infants, young children, and women who are pregnant or could become pregnant, and other minerals like selenium, zinc, and iodine. While it's important to limit mercury in the diets of women who are pregnant and breastfeeding and young children, many types of fish are both nutritious and lower in mercury. Caffeine is a stimulant and a diuretic. Because caffeine is a stimulant, it increases your blood pressure and heart rate, both of which are not recommended during pregnancy. Caffeine also increases the frequency of urination. This causes a reduction in your body fluid levels and can lead to dehydration. Caffeine crosses the placenta to your baby. Although you may be able to handle the amounts of caffeine you feed your body, your baby cannot. Your baby's metabolism is still maturing and cannot fully metabolize the caffeine. Any amount of caffeine can also cause changes in your baby's sleep pattern or normal movement pattern in the later stages of pregnancy. Remember, caffeine is a stimulant and can keep both you and your baby awake. High levels of caffeine in pregnancy can result in babies having a lower birth weight, which can increase the risk of health problems later in life. If you're pregnant, limit the amount of caffeine you have to 200 milligrams a day. This is about the same as 2 mugs of instant coffee. The less caffeine you consume, the better. Some experts say more than 150 milligrams of caffeine is too much, while others may consider up to 300 milligrams the upper limit. Caffeine is found in more than just coffee. Caffeine is not only found in coffee, but also tea, soda, chocolate, and even some over-the-counter medications that relieve headaches. Be aware of what you consume. Avoiding caffeine as much as possible is your safest course of action. If you must get your caffeine fix, it is best to discuss this with your healthcare provider to make the healthiest choices for you and for your baby. Pregnant women are strongly urged not to drink alcohol during pregnancy. Drinking alcohol while pregnant has been shown to cause harm to the baby as it develops in the womb. Alcohol used during pregnancy may also lead to long-term medical problems and birth defects. When a pregnant woman drinks alcohol, the alcohol travels through her blood into the baby's blood, tissues, and organs. Alcohol breaks down much more slowly in the baby's body than in the adult. This means that the baby's blood alcohol level remains increased longer than the mother's. This can harm the baby and sometimes lead to lifelong damage. Drinking a lot of alcohol during pregnancy can lead to a group of defects in the baby known as fetal alcohol syndrome. Symptoms can include behavior and attention problems, heart defects, changes in the shape of the face, poor growth before and after birth, poor muscle tone and problems with movement and balance, problems with thinking and speech, learning problems. These medical problems are lifelong and can range from mild to severe. Complications seen in infancy may include cerebral palsy, premature delivery, pregnancy loss, or stillbirth. There is no known safe amount of alcohol use during pregnancy. Alcohol use appears to be the most harmful during the first 3 months of pregnancy. However, drinking alcohol any time during pregnancy can be harmful. Drinking moderate amounts of alcohol when pregnant may lead to miscarriage. Heavy drinkers, those that drink more than 2 alcohol beverages per day, are at a greater risk of giving birth to a child with fetal alcohol syndrome. The more you drink, the more you raise your baby's risk for harm. Do not drink during pregnancy. Women who are pregnant or who are trying to get pregnant should avoid drinking alcohol. Pregnancy might seem like the perfect time to reduce your activity level. You feel like you're more tired than usual and your back might ache from carrying the extra weight. But unless you're experiencing complications, sitting won't help. In fact, pregnancy can be a great time to get active, even if you haven't exercised in a while. During pregnancy, exercise can reduce backaches, constipation, bloating, and swelling. It can boost your mood and energy levels, help you sleep better, prevent excess weight gain, and promote muscle tone, strength, and endurance. Other possible benefits of following a regular exercise program during pregnancy include a lower risk of gestational diabetes, shortened labor, and a reduced risk of having a C-section. Pregnant or postpartum women should do at least 150 minutes of moderate intensity aerobic physical activity per week, such as a brisk walk during and after their pregnancy. It is best to spread this activity level out throughout your week. Make sure you talk to your health care provider before beginning an exercise program. Gastrointestinal or GI issues are some of the most common complaints during pregnancy. Some women may experience GI issues that develop after becoming pregnant. GI problems affect the GI tract, primarily the esophagus, the stomach, the small intestine, large intestine, and rectum, but can also affect other organs of digestion, including the liver, gallbladder, and pancreas. Some women may have chronic GI disorders prior to pregnancy that can worsen and require special consideration during pregnancy. Some of the most common GI issues women experience during pregnancy are nausea, vomiting, gastric reflux, and constipation. Changing what, how often, and how much you eat can help manage or relieve GI symptoms. Depending upon your issue, you may need to increase the amount of fiber in your diet, avoid sugary, spicy, acidic, and processed foods, or limit the amount of caffeine and high-fat dairy in your intake. Increase the amount of fluids you take in, including water, fruit juice, and clear soups. Getting lots of fluid can help your digestion and keep your GI tract moving regularly and prevent constipation. You can always speak with a registered dietitian to determine individualized healthy eating plans that would benefit you and your child the most, especially if you're having odd or unsure food cravings during pregnancy. Immune system changes in pregnant women place the women themselves, their unborn children, and their newborns at increased risk of foodborne illness. These illnesses can be worse during pregnancy and may lead to miscarriage or premature delivery. Some foodborne illnesses, such as listeria, can infect the fetus even if the mother does not feel sick. This is why doctors provide pregnant women with specific guidelines about foods that they should and should not eat. Some basic food safety guidelines include: avoid raw and undercooked foods, reheat smoked fish and deli meats to 165 degrees Fahrenheit, avoid unpasteurized juices, raw milk, and cheese made from unpasteurized milk. Keep hot food hot and cold food cold. When in doubt, throw it out. All of these are basic food safety guidelines to help ensure you reduce any risks during pregnancy. Pregnancy is an important time for both mom and baby to get good nutrition. But some health conditions while pregnant can make getting good nutrition a bit more challenging. You may want to schedule a visit with the dietitian for nutrition counseling if you have any of these special categories of pregnancy. If you're vegetarian or vegan, if you have a family history of gestational diabetes, if you have a history of an eating disorder, if you've recently gained too much or too little weight, if you're under 18, or if you had food allergies or intolerances.